no one seems to really want to take responsibility. But you know what happens when no one takes responsibility? Nothing gets done. And that's what we're seeing here.
When I heard COVID was in aged care homes again, I was horrified to think that elderly people had not been vaccinated.
For relatives of Melbourne aged care residents like Sally Kinraid, it's a hauntingly familiar scenario, with 4 facilities back under COVID lockdown.
My father-in-law has not yet been vaccinated for COVID. I think it's very disappointing that we're here again with a similar situation to what we experienced last year. We were told it would never happen again.
Despite promising that all aged care residents would be vaccinated by the end of March, today the federal government admitted only 44,000 out of 48,000 aged care residents in Victoria have received a dose.
This is the lounge room.
Nigel Hart is one of the lucky ones. All the residents at his locked-down Melbourne nursing home have been vaccinated.
It reminds me when we first got locked down last year, and last year we lost 17 residents.
The main issues is we didn't learn well enough from last year, and we didn't look deeply enough into what went wrong last year to make sure that this had been corrected.
This week it was revealed that staff members at another nursing home who tested positive had worked at other facilities. It's long been the practice that casual staff work multiple shifts across different facilities in order to earn a livable wage.
Staff do work across sites and across different companies, basically because it's quite a transient workforce. So they might only get 2 shifts at one residence a week, and they have to go to another residence for the other 2 shifts a week. They might be the breadwinner for their family.
But the issue was a major driver of infection during Melbourne's second wave, which saw more than 600 aged care residents die. So in response, the federal government brought in a policy on July 19 last year intending to stop casual staff working across multiple homes by paying centres to keep staff at one site. But the temporary measure was lifted in November and it was never enforced in privately run facilities. In response to Melbourne's outbreak, the temporary measure and funding was reinstated on May 27. But the federal aged care minister today admitted the problem is not straightforward.
It's actually not legal to limit somebody's capacity to work. In fact, the Health Services Union took an aged care provider to the Fair Work Commission in March last year in New South Wales and was successful in that case.
Staff working at multiple sites we know was a problem last time, and it appears to be a problem again this time.
Professor Joseph Ibrahim is a geriatrician who heads up a health law and ageing research unit at Monash University.
The solution is not to blame the providers and it's not to blame the workers. The solution is to find more workers. That, I think, is a prime example where the government hasn't dug deep enough to the underlying cause and is addressing an issue superficially by simply saying you shouldn't work across both sides.
Health Minister Greg Hunt said the decision was made on advice of the Chief Medical Officers of the Commonwealth and States.
Single site arrangements are complex and should not be required where there is a low risk of COVID-19. It is important that the sector and government are prepared to implement single site arrangements quickly where required.
In Senate estimates, Minister Colbeck admitted the government doesn't know how many Victorian aged care workers have received vaccinations.
We will be requiring aged care providers to report that data to us alongside their reporting of vaccination of flu vaccine.
But you don't know?
Well, we don't have that data.
I think it's incorrect to say it's not a race. It's a race to save lives. Given that we waited, I would have expected a far better rollout, far better communication strategy and far greater engagement with the aged care sector and the aged care workers in particular.
In January, the government said the vaccination of aged care workers would be a top priority.
We've seen the tragic consequences of outbreaks in residential aged care. So aged care facilities and the workers who can spread the virus generally will be a high priority.
In March, the federal government's aged care COVID vaccination implementation plan recommended aged care staff be vaccinated at their workplace.
What that meant was if there was some vaccine left over at the end of the day, the staff would get vaccinated if they were there. Otherwise, there was no plan for them to get vaccinated. They would get vaccinated through the usual mechanisms. Entirely unacceptable.
The coverage of those residential aged care facilities, Mr Speaker, has been significant, particularly as we go into the winter months, Mr Speaker, and the coverage of all those facilities on their first doses, Mr Speaker, and we now must move quickly to ensure the balance of those doses are provided.
This afternoon, the Victorian government announced aged care workers could skip the queue to get vaccinated at walk-in hubs for the next week.
I think the vaccinations have been a little bit slow. I think the stock's been a little bit slow.
Sarah Hughes is a senior manager working across aged care facilities in Melbourne. She said the latest outbreak has tested staff still traumatised by the last wave.
We're all quite anxious. This is bringing back a lot of what happened last year and the grief that we all felt.
Meanwhile, Victorians are eagerly waiting to see if the lockdown will end Friday morning as planned.
I don't know if there's going to be an extension or not. There is every prospect that things might get worse before they get better, and the aged care settings are quite troubling. But I've got to stress, there has been no decision as yet.
I think we'll likely be in lockdown for 2 weeks. It's going to be somewhat lengthy and somewhat prolonged in terms of us having more restrictions for longer.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.